This is an improvement to the cardiac reflex. You remember last year we talked a little bit about the cardiac reflex, and we talked about, if a stomach problem, it's on the left side, and if it was a cardiac, it was usually on the right side. But we found out something new on this. If they have a hiatal hernia or a cardiac reflex test, in other words, pushing up toward the sternum and the leg goes short, that tells you that it's a hiatal hernia or a cardiac reflex. And so what we were finding is if we were doing the hiatal hernia on the left side and it wasn't clearing, that meant there was a cardiac reflex. And what are the thrusts for the cardiac reflex? The cardiac reflex is anterior and inferior on position number 1 or contact point number 1, and then 2 inches down and 1 inch to the right for position number 2, and then 2 inches down and 2 inches to the left. Here's the change, and there's the contact anterior and inferior. Let's do that again. When you have the patient prone, you reach underneath and push toward their head. If the leg pulls up, that means you've either got a hiatal hernia or a cardiac reflex. If you take the hiatal hernia and do that first, you would go inferior on the contact point, and then you would go to the stomach side, the left side. You go down 2 inches, over 1 inch, down 2 inches, and over 1 inch. That's the hiatal hernia. But if that doesn't clear it, you probably have a cardiac reflex. Then you go anterior, inferior on your first thrust. Then you go over to the 2 inches down, 1 inch to the lateral on the second thrust. Then you come to the right and you go down 2 inches and over 1 inch, and then anterior and inferior. That's on the right side. Now you notice that cardiac people have always talked about before they had a heart attack, they had the stomach problem. And we're beginning to think that there's something to do with the stomach and with the gallbladder. But just so you remember again, anterior, inferior, this is the hiatal hernia. Anterior, inferior, 2 inches down, 1 inch to the left, then 2 inches down and 1 inch to the left. That's the hiatal hernia. If that doesn't clear it, then you go anterior, inferior on the first contact point, just below the sternum. And then you go down 2 inches, over 1 inch, anterior, inferior on the left, down 2 inches, over right, anterior, inferior. That's the cardiac reflex. So those are two different reflexes, but I wanted to clarify those for you. And you'll see them show up in that 642.